Good afternoon, everyone. The time is 1:30, so we will begin. This is Shelby Walker with the Tennessee Department of Health. Thank you all for joining us today, and thanks for being flexible with the time, which we did change from our usual 2 o'clock slot. We will be hearing shortly from Tennessee Health Commissioner Dr. Lisa Piercy. All the information provided during today's briefing is on the record. You may record the briefing and or stream it if you wish to do so. We will be using the raise hand function to take questions following Dr. Piercy's remarks, and we'll call on people in the order they appear. If we have more than one person from the same outlet, we'll take over what's going on first and give everyone an opportunity to try to get their questions. With that, Dr. Piercy, we're ready to go.
Thank you, Shelley. Good afternoon, everyone. I echo my appreciation for your flexibility. I did have somewhat of a non-negotiable schedule conflict pop up at 2 o'clock, so we'll have a hard stop at 2 o'clock today. The top line for us today is a reminder that Phase 1C is open. That opened yesterday, and we believe that based on Tennesseans' metrics, that about 30 to 40% of all Tennesseans are now eligible based on health conditions. That is in addition to the 65 plus eligibility that we've had for a couple of weeks now, but now that list includes a lot more people. We initially estimated that population at about 1.1 million. We've gone back and with some additions and with some other calculations, it may be closer to 1.5 million people. So a lot of people who have been anxiously awaiting for vaccine are now eligible and are encouraged to book appointments. Now, speaking of appointments, I want to remind you of a couple of things. Whereas the health departments all across the state have vaccine and have availability, we actually make up a small percentage of the overall number of sites. There are hundreds of sites across Tennessee that offer vaccine. And so in addition to your health departments, please search out and seek out other providers in your communities. The best way to do that in one central spot is at vaccinefinder.org. You can go on there and put in an address or a zip code, and it will give you a listing of all of the sites in that area, and you can sort by how far you're willing to drive. That includes health departments and pharmacies, hospitals, other providers, and you can even sort by product. If you want a particular product, Pfizer, Moderna, and then now Johnson & Johnson, you can search by that, and it will even give you an indication of the inventory level. Not specific, but whether they have limited inventory or fully in stock or out of stock. So vaccinefinder.org is a really good place to find locations. I will remind you that all 95 health departments are ready, willing, and able to serve your needs as far as vaccine. Our scheduling system that we launched with the 89 rural health departments, we launched that probably 3 weeks ago now. I checked last night and there were over 400,000 available appointments statewide. Now, that doesn't mean they're all this week, and it doesn't necessarily mean that they're in your particular county, but we've got widespread availability going out through early May, and in many instances, you can get an appointment in some counties as soon as 24 to 48 hours. So check out our website if you want to be in one of the health department pods, or vaccinefinder.org if you want to go outside of the health department system. Also, just wanted to provide a little bit of a reminder of who all is included in Phase 1C. So when I say high-risk medical conditions, I think people automatically think about cancer and transplant and people that are very severely ill. And yes, it does include those, but it also includes many, many other people who may not consider themselves as high risk. One of those is obesity. So a BMI of 30 or more. And if you don't know what your BMI is, it's a way to calculate the proportion of your height and weight. You can easily do an online search for BMI calculator and put in your height and weight, and it will tell you what your BMI is. And so now anyone with a BMI of 30 or more, which is considered overweight, they now qualify. Same thing with diabetes. And that's part of our plan update that I'm going to reference today. I'll tell you more about that in just a minute. But anybody with diabetes qualifies now. And the reason that I called those two conditions out first is that we're starting to see a lot of emerging science just in the last 2 or 3 weeks that people, regardless of other health conditions, if they have diagnoses of obesity or diabetes, they are at much higher risk for hospitalization, and particularly with diabetes, for death from COVID-19 versus other people without those health conditions and everything else being the same. So we're really starting to see the science emerge to really emphasize the need of vaccination in those with obesity and diabetes. There are a lot of other conditions, maybe up to about 30 conditions on the 1C list. Another very common one is hypertension. And it does not require that you're on medication, but that you have a diagnosis of hypertension. Same thing with COPD. Some people call that emphysema, or moderate to severe asthma. Those are very common conditions. Another common condition that is a happy condition is pregnancy. And for pregnant women who want to be vaccinated, they are included in 1C, as are their household contacts. We've also made some additions to our plan. As per usual, we typically issue a plan update when we move into the next big phase. So we have posted that updated plan online. I'll highlight a few additions for you. I mentioned it just a minute ago. We have removed the medication requirement for people with diabetes. So anybody with a diagnosis of diabetes is now eligible, regardless of whether or not it requires medication. That was directly of a result of the science that came out a couple of weeks ago about increased mortality for diabetics if they are infected. Likewise, I just mentioned we formally added household contacts of pregnant women. We've been talking about that for a couple of weeks now, but we formally added that to the plan. We also added high-risk progressive neuromuscular disorders. That's a long description, but basically includes very severe neuromuscular disorders like ALS, Lou Gehrig's disease, muscular dystrophy, or multiple sclerosis. Those aren't as common as some of the other conditions that I've named, but are important to be on that list. And finally, we've added Down syndrome to that list, understanding that people with Down syndrome may have other comorbidities, but for those who don't, we want them to be included in 1C as well. So that plan update is on our website and should also be reflected in the other digital assets that we have with those changes. So in addition to the plan update, I want to remind you of something that's been in the plan all along, but hasn't been front and center, and so it might not be front and center in your mind. And I've had this conversation with several people over the last few days when particularly like manufacturers or employers say, well, when do you think we're going to get to phase fill in the blank, 2, 3, whatever their phase is? And I'll answer the question about projected timing, but I will always remind them, hey, we're in 1C now, which means if your workforce is in Tennessee, probably 30 or 40% of your workforce qualifies now. And so we've always had a system to where whenever the first time you qualify, even if you qualify in multiple phases, you don't have to wait to a later phase. You can get it sooner. And so many employers, many of those industries that are in the critical infrastructure phasing, I want you to be very cognizant that a large portion of your workforce, and maybe you individually, you don't have to wait until your phase comes up if you qualify sooner. So saying that a different way, or maybe in summary, regardless of employer, regardless of employment status, whether you're employed or not, regardless of living setting, what kind of setting you live in, if you are eligible in 1C, you don't have to wait to that future phase or that further phase. That includes things like workplaces that I've already mentioned, but also college campuses or prisons. There are populations in both of those congregate living settings that will cause them to qualify sooner, and so they are eligible now. So if you haven't been able to get it through your employer because of future phase and you're eligible now, you should go ahead and get signed up for a vaccine. One more comment specifically to TDOC, or Department of Corrections. They are being provided with vaccine beginning last week. They are getting both Johnson & Johnson and Moderna. There is a lot of desire for the one and done, one shot and done. And so we have provided an allocation from our very first tranche of the Johnson & Johnson allocation last week to the Tennessee Department of Corrections, but in an effort to give those who are incarcerated a choice, we are also offering them Moderna, which is easy to store or easier to store on site than the Pfizer product. So the TDOC population will have a choice between Moderna and Johnson & Johnson. A couple of more updates, and then happy to take questions. Want to give you an update on our work in Shelby County. Two things. It's going slower than I wanted it to, but we're finding better information than I expected. And so that's encouraging. It's frustrating for everybody to have to postpone things or drag this on any longer than it has to be, but we want to make sure we get every piece of information that is available. And you've heard me say, part of the issue at Shelby County was with efficient record keeping. And so that's what we're dealing with. That's what's taking a little bit longer. But the good news is that in a lot of cases, we are finding the information. It's just not readily available to us. So now that more information continues to come in, our team is still on the ground piecing together this information. And what we're finding so far is pretty encouraging related to the temperature stability of those vaccines. And so I hope to have that work wrapped up pretty soon, but it is going a little bit slower than we initially expected. I will continue to brag on the work of City of Memphis. By all accounts, they are doing a fabulous job at having very efficient and effective events. They have been doing a great job at allocating and making sure that is stored properly and handled properly. And so thanks again for City of Memphis stepping into that gap and really picking up the slack there. And then finally, I wanted to make sure that you are aware of the new CDC guidance that came out yesterday. I understand it might be a little confusing to folks, and so I wanted to give a summary for that. The CDC issued guidance yesterday for actions that can be taken by fully vaccinated people. So let's first define what fully vaccinated means. That is 2 weeks after the last dose in the series. So for Pfizer and Moderna, that's 2 weeks after the second dose. And for Johnson & Johnson, since it's just one shot is a complete series, then it's 2 weeks after your vaccine for Johnson & Johnson. That means you can be visiting with other fully vaccinated people with no restrictions. No masks are required, no distancing is required if everyone is fully vaccinated. So we're not quite there yet, we're getting there, but in those instances, there are no requirements from the CDC's perspective. Now, the CDC guidance also allows for vaccinated people to visit with unvaccinated people from a single household if they're low risk. And so that kind of makes sense. So if you're vaccinated and you visit with someone who isn't vaccinated, you don't have to take those precautions, provided that person is at low risk, meaning they're not elderly, they don't have a severe medical condition, and CDC new guidance does allow for that. The other big change that they made yesterday is that for people who are fully vaccinated, they no longer are subject to quarantine or testing if they have come into close contact with a COVID-19 case, as long as they don't have any symptoms. They call that asymptomatic. So that's not drastically different than their last guidance. They did issue that guidance a few weeks ago, but they put a time frame on it. This has an indefinite time frame. There's no more 3 months or 6 months. It is indefinite. Let me give you the warnings. The CDC says that you must still distance and wear your mask when you're in a public setting, presumably because you could come into contact with some of those high-risk individuals unknowingly. Likewise, if you're interacting with people from unvaccinated people from multiple households, or if you're in any type of gathering of medium to large size, specifically indoors. And then finally, you should always wear your mask around somebody who is unvaccinated if they are high risk. And that the impetus there is because we're still not entirely sure from a scientific standpoint if you can transmit it asymptomatically after you've been vaccinated. We believe that you probably cannot. And I personally think that we're going to get to the place where we can confidently say that you can't spread the disease if you're vaccinated. We don't have the scientific confirmation of that yet, so we still want to urge caution when you're around unvaccinated high-risk people that there is still a risk that you could be an asymptomatic carrier and pass that along. Hopefully we'll get that cleared up from a scientific standpoint pretty soon, but I was encouraged by some of the science put out by CDC yesterday regarding fully vaccinated people. So I'll stop there, and Shelly, happy to take questions.
We do have several in the queue. We will start with Jessica Jacqueline from WMC.
Hi, Dr. Piercy. Obviously, a lot of Shelby County residents are concerned about the temperature that their doses were stored at. Can you expound a little more on what you have discovered so far and what you all still need to do in that investigation?
Sure, Jessica, that's a great question. And that's exactly what I was referring to when I said that we were still getting information and piecing it together. Initially, when we had so much difficulty sorting through the records, really the biggest gap was, does this information exist? We initially thought that there was a lot of temperature logs and temperature stability data that just simply didn't exist because it wasn't measured or recorded. We have learned over the last couple of weeks that in many instances, that information does exist. That has also been complicated by the fact that a couple of people who were record holders of those particular records are no longer employed or no longer engaged in that work, and so weren't able to get information from them on where those data logs were stored. So we've been able to find some, and we've been able to surface some of those, and putting the pieces together to ensure what we call cold chain stability, or making sure the temperature is stable all the way from the beginning to the end. We're getting some of that information, and in almost every case where we have the information, it does appear that they're fine. And so we've still got some work to do there, but as soon as that work finishes, I plan to come back and say, I'm confident that these vaccines were stored at the right temperature and you can be reassured, or if there is an instance where we're not, to be able to tell you that.
Thank you. And why are those people no longer employed or working there?
They're Shelby County Health Department employees, and that would just be a good question for county government.
Thank you.
Thank you. Our next question is from Corinne Kennedy with the Commercial Appeal.
Hi, Dr. Piercy. Thanks for your time today. To follow up on that question, can you give an indication of how many doses are in question in terms of the investigation into whether any doses did expire, and what date ranges you've been looking at?
So if we're going to make an effort as large and public as we've made, we're going to check everything. So we are going all the way back to the very beginning, that we don't have concerns for every single day in that whole time frame, but we are checking to make sure we can ensure temperature stability for every single date that vaccine has been administered, because we understand that the public has some questions about that, as do we. And so we want to ensure that. And so I'm looking at every dose and every date range in the entire vaccine effort.
And at this point, you've mentioned what you have found is encouraging, but are you still concerned that anyone might have to be revaccinated in Shelby County?
I'm just still waiting on additional data. We're not at a point yet where we can say yay or nay. I am very encouraged that what we have found does indicate that temperatures were being measured and were being tracked. The process for keeping and producing those records has been a little bit less than ideal. But from what we found so far, it looks like that for the data that we have, the vaccines were kept in temperature, which gives us no indication that they weren't fully effective doses.
Thank you. Our next question is from Marta Aldrich with Talkbee.
Hi, Dr. Piercy. My question is related to tracking and reporting vaccinations of teachers and school staff. Your team has said Tennessee is not tracking this data, but if the number of vaccinations, the refusal rate is unclear, it's harder for parents and other teachers to assess their own health risks as schools reopen. So why isn't Tennessee tracking and reporting this data?
Yeah, that's a great question, Marta, and perfectly legitimate to ask that because I do recognize that some states are tracking uptake by group. In Tennessee, the only thing that is being recorded or tracked, if you will, is the only thing that's required by the federal government, which is we have to enter it into the federal immunization, well, it's our state version, but the immunization database, and then every state has one of those. And that is just as much for public safety and private medical uses. For example, if you go to a different physician, they can pull up to see what your first dose was so they can give you this right second dose. Same kind of thing of timing of doses. If we were ever to need a dose in the future, they would need to be able to look up to see actually what the date was. On specific populations, so teachers would be one of them. Obviously, healthcare workers are another group that we've already vaccinated. The best source for uptake rates are with those private employers. So whether it's the school district or hospitals, as it were, because that sort of becomes a personnel issue for them. And so they very well and quite frankly likely are tracking it on the employer level, but we don't track that as a population for the state. Of course, we have anecdotes and we have estimates, just like I've given you in the past on healthcare workers. I suppose we will have the same for teachers, but specific uptake rates should go back to the school districts.
And there's no plan to try to recoup that data. There's no consideration of beginning to track it in order to get a statewide view of that?
We don't have any formal efforts for that. There are a lot of superintendents that I suppose will tell us what those rates are, just like a lot of hospital and healthcare or health system CEOs have told us. And so we can aggregate that and give you an estimate of what that is, but we don't have any formal plans to track that specifically.
Thank you. Our next question is from Kimberly Creasy with the Associated Press.
Hi, Dr. Piercy. My question is regarding inmates. There appears to be a conflict between what the Department of Health is saying and the Department of Correction on when the state was planning on vaccinating inmates. In a statement provided by your department today, it said that it was always the state's intention to, as long as someone became eligible, to vaccinate that person regardless of where they lived. The Department of Correction told me on February 23rd that they were not beginning to vaccinate inmates, even though the state had opened it up for 65 and older. So can you help clarify that disconnect between these two agencies? Was there a breakdown in communication? Was the Department of Correction supposed to be vaccinating inmates over the age of 65 and older earlier this year?
So remember, we just went to 65 plus 2 weeks ago, and so it really hasn't been that long since we've been in the 65 plus category. I would refer any operational questions back to either Dr. Williams, the medical director, or Commissioner Parker at TDOC, but there's not been any kind of conflict or miscommunication there. I suppose, and it's just my assumption, you would have to ask them for details, but there's probably not a critical mass of incarcerated individuals 65 plus. Certainly there are some, but from an operational standpoint, it's a very large population that is going to take a lot of coordination to vaccinate all of them. And so their eligible population went from something very small to very large this week. And so now it probably makes a little more operational sense for them to do it, specifically when they knew a couple of weeks ago that we would be moving into 1C. Any specific questions would have to go back to TDOC, but no issues on our end in that regard.
Okay, just quickly, so why are we learning today that inmates can be vaccinated? The State Department you guys have been very vocal about the 1C population, but why is it today that we're learning that inmates qualify?
I don't know that that's any different than me saying today people at a large manufacturing plant are eligible for 1C. It's really not any change from the entire plan going on. It's not particularly something that we were going to call out, because everybody, regardless of their employment status, their employer, their living situation, is now eligible. So, for example, everybody that works at the big Amazon warehouse today, even though they may not be until a future phase, they also are eligible for their 1C population today.
Thank you. Our next question is from Tony Sloan at Fox 13.
Hey, so you spoke briefly about Memphis and Shelby County. Tell us a little bit about what it's looked like since that transition of power has gone to the city opposed to the county. What's that look like for you guys, and how are you liking it?
Sure. So the city of Memphis has done a great job on very short notice of stepping up to the plate and helping out with those sites. But really, a lot of the allocation decisions and day-to-day work is being handled in the same manner in that COVID task force, where they all come around the table. And now City of Memphis is leading that as opposed to the health department. There's a lot of partners at the table, and there's always been a really good collaborative working relationship amongst hospitals and pharmacies and FQHCs, as well as city and county in Memphis, Shelby County. And so that work continues, and it's going well. City of Memphis is doing a great job running their sites, and they're doing well over 30,000 vaccines a week just at their sites alone, and have a continued willingness to grow that. So for all accounts, it's going pretty well from our perspective.
Thank you. Our next question is from Joshua Cole with WSMV.
Hi there. I had
I think we may have lost you, Joshua.
Can you hear me now?
Yes, sir.
Oh, sorry about that. I know Nashville today announced that they're going to have a mass vaccination clinic, not this Saturday, but the next, with 10,000 appointments. Is there any plans with the state to do something similar to that, as far as whether getting it directly into the counties, or just having kind of a here's one specific spot for everybody to come to in a particularly maybe more rural area? And then also, I know some other states have really tried to relax on some of their restrictions. Is that something that is also being talked about here in Tennessee as well, especially with counties, what control the counties have been given by the governor's orders?
Sure. So I'll take both of those questions, and then I see we're running up on time, but people still have their hands raised. So please email your questions to Shelly, and I'm happy to get those answered for you after this. But Joshua, to answer your first question about mass vaccination sites that the department or the state might be doing, in fact, the meeting just before this one, we were talking about that very thing. We are really proud of Nashville Metro and this really large event that they've got planned for not this weekend, but next weekend. I think the ability to vaccinate up to 10,000 people on one day, first of all, is an enormous undertaking, but I know a lot of folks over there, both in the health department and in the mayor's office, and I know they're perfectly well equipped and able to handle that. So I'm looking forward to that event. It gets a little bit harder to do that in rural areas for a lot of different reasons, barriers to transportation and finding a population center. These very large events work much better in a population center where there are concentrations of people. So we're frequently brainstorming in the state on how can we both simultaneously deliver large numbers of vaccines, but yet not erect these artificial barriers for people who may live out in rural geographies. So mass events, albeit on a much smaller scale, sort of like we did back in the spring with pop-up testing all along the state, that is certainly something that we're looking at, and some counties are already doing that. And then the other thing that we've talked about just a few minutes ago was how can we expand access in our rural counties, but sort of within the framework that we have. Ideas that we talked about would be early morning hours, evening hours, occasional weekend hours, opening up more lanes, more people, and so that work continues. But I think the ultimate answer is you will see a mix of these mass events and a beefing up of capacity in the more decentralized locations throughout the state. I'm really glad you asked me about restrictions because I think there are some misconceptions. At least I got a lot of questions just from friends and family. I guess it was last week when Texas and Mississippi said, hey, we're opening up and we're doing all this. When do you think Tennessee might do that? And I kind of chuckled to myself because the answer is we did that back in August. The state hasn't had any restrictions on gathering sizes or capacity limits as long as certain distancing, social distancing is maintained. Now, metro areas are different, and you know why those jurisdictions are separate. But from a state standpoint, we really haven't had any restrictions for about the last 6 months. And as you know, we never had a mask mandate statewide. And so there is no mask mandate to undo. So from that standpoint, I think it kind of flew under the radar. And there was this perception that Texas and Mississippi were ahead of us when, quite frankly, they followed our lead. So I'll stop there and happy to answer the rest of your questions by email. Thanks, guys. See you next week.
Thanks, everyone. That is our time for today. If you have remaining questions, you can send those to tdhmedia@tn.gov and we'll respond as quickly as we can.